welcome everyone to the Institute for Work and Health's speaker series. I'm delighted to present our speaker today, Dr. Lynda Robson. Before I tell you a little bit more about her and what she will be talking about today, I want to just run through some of the housekeeping for this presentation. We welcome comments and questions for the presentation. I hope you will engage with us. If you have a question or comment, please type it into the question and answer box that you'll find along the bottom of your screen. If you would like to activate closed captioning, you can also find that. It's often under the More button, again at the bottom of people's screens. And we will be recording the presentation and making it available to anyone who is interested. And that takes about it takes a few days. So it should be available in about a week if you would like to, again, look at some of the slides and hear the presentation. I guess one last thing, sometimes we do have a fair number of questions. Please don't let that stop you from asking anything. If we don't get to your question, Lynda will make her email available on the end of the end of the slides, and so please do reach out and contact her directly. Well, let me introduce our speaker today. Dr. Lynda Robson is a scientist at the Institute for Work and Health. She is a former adjunct professor in the School of Occupational and Public Health at Toronto Metropolitan University. And her research interests include both quantitative and qualitative methods to study occupational health and safety management, as well as organizational change in OHS and the evaluation of prevention programs, especially OHS training programs. And today, Lynda is going to talk about how new businesses get their start in workplace health and safety and implications for research and policy. Welcome, Lynda, over to you.
Thank you, Monique, and good morning to everyone. I'm so glad you could be here to learn about our recently completed research on new businesses and their initiation of OHS management. Now, this is a topic that hasn't got a lot of attention in the research community to date, and I hope by the end of the presentation, you'll feel that it is a topic worthy of more investigation by researchers and perhaps policymakers as well. I'd like to acknowledge the members of the research team, collaborators in the Ontario government, funding from the former Workplace Safety and Insurance Board Research Grant Program, now the WorkSafe Ontario Fund, and the members of our Project Advisory Committee. So as mentioned, there's a research gap in this area in terms of new businesses and their occupational health and safety management. We confirmed that this year in an environmental scan, and I believe you'll get a link to a lay summary of that research in the chat. Certainly, OHS researchers have developed a body of knowledge about small businesses, and that's been very helpful, and it's, a basis of our understanding. But we think that the inception of the business is a distinct phase in the life cycle of a business, and it could have then distinct preferences and opportunities for intervention. About 100,000 businesses are created in Canada each year that will employ workers. And we have reason to believe that these new businesses will pose a excess risk of injury, illness, or fatality for workers, some of these new businesses. And that's because they're small businesses and they're full of short tenure employees. Both factors have been associated with increased risk. Now, I'd like to orient you to the province of Ontario, and that's because I'll be making reference to some of these organizations and activities as I go on. And I hope you don't walk away because of the Ontario focus. I think by the end, you should see some relevance to your own jurisdiction. So there's the Ministry of Labor, Immigration, Training and Skills Development, which I'll call the Ministry of Labor from now on. There's the Health and Safety Associations, also known as HSAs, and the Workplace Safety and Insurance Board, WSIB. Now, if we think about the three main ways that public authorities can exert influence, that is carrots, sticks, and sermons, I've provided here a simple overview with respect to primary prevention of workplace injury and illness. So there indeed are incentive programs in place where workplaces can demonstrate, establish a certain level of occupational health and safety management. And in doing so, they'll be rewarded financially and with recognition. These programs tend to attract more established businesses, larger businesses. There's also the OHS Inspectorate, overseen by the Ministry of Labor. They do carry out proactive inspections, but in Ontario, as in all jurisdictions, it's impossible to visit all new businesses that arise each year. And then there's the educational approach. The ministry does have web pages with information and tools. And if you enter the incentive program at WSIB, there are educational steps. But the real specialists in this area are the health and safety associations. They've developed training, information resources, and consultation services that are tailored for specific sectors and also, in some cases, businesses of different sizes. Our first objective in this study was to describe the initiation of OHS management by new businesses. And the second was to identify and describe the factors associated with the initiation, or correlated with the initiation. We had a secondary objective of exploring the reaction of new businesses to possible future interventions. We carried out a cross-sectional survey last year. We recruited 351 businesses with employees. These businesses had registered 1 to 3 years prior as single owner businesses with the Ontario Business Registry. Through the registration process, they assign themselves a particular industrial sector, such as construction. And we, at the outset, made the decision to exclude what we perceived as the lowest harm sectors. So, for example, we excluded finance, where office environments would predominate. Not that offices don't pose some hazard to employees, but we wanted to focus on where more serious harms would be expected. There is a second part to this study, which I won't be talking about today. So please stay tuned to our speaker series. The co-lead of this project, Dr. Bashak Yunar, will be presenting on that portion of the study in the coming year. As far as who participated in the survey, most were owners involved in day-to-day operations. And they were diverse in their immigration experience, their racial, ethnic background, their gender. And 2/3 had no prior experience as an owner or senior manager of operations. And when I reflect on that, I think, okay, it's one thing to know your job as a worker and how to stay safe within that job. And it's another set of skills to know how to plan for the health and safety of others in a business. These businesses were tiny. Half of them had 2 to 5 employees. And they came from a variety of sectors. Leading were construction, retail, support to buildings, which was mostly janitorial services, and several others. And if you scan the list of these sectors, you might have some potential occupational hazards coming to mind. And we, in fact, had a measure of that using an instrument that's been developed at the Institute. And I believe a link to that will be put in the chat. And with this, we ask about 8 different physical hazards, 1 psychosocial hazard, and we asked how frequently the workers in the business would be exposed to these hazards. And from that, we were able to assess that about half of the businesses had hazardous exposures needing mitigation. For sure needing mitigation. There should be mitigation in all workplaces, of course, even if they're lower frequency. Hazards, so hazards of concern, and I'll come back to that. So let me turn to the results and how we measured the initiation of OHS management. So we asked 9 different questions, potential OHS management actions that we could imagine being appropriate for small businesses, ranging from the simple, such as simply finding legal requirements about OHS, to the more sophisticated, like systematically identifying all hazards, and asked respondents to give an answer of nothing. When we asked to what extent have you carried out the action, they could answer nothing done at this time, done some work on it, or done this or put it in place. So to measure the extent of management, we counted the number of this last type of response across the 9 items and could assign then a score to each work business from 0 if nothing had been put in place to 9 if everything had been put in place. And when you look across these businesses, you'll see there was, in fact, the full range of scores, with 10% of businesses reporting having done everything, and about a quarter of businesses saying that they had done nothing. Now, we use this count to define initiation of management, saying that 2 or more actions we would consider OHS management initiated. And if there were 0 to 1 actions, it was not initiated. So that's just over a third of the sample. And just to, I guess, underline that these were not risk-free workplaces in this group of not initiated. From our assessment, 41% of them had hazardous exposures of concern that past research shows if they are not mitigated, they will lead to an increased incidence of workplace injury or illness. So let's look at some other factors that we investigated with respect to initiation. And when we did this, we referred to this conceptual framework for understanding behavior. And this comes out of 19 different behavior change models, and under that lies a big body of research. And it's essentially saying if we want to understand a behavior, or perhaps how to even change a behavior, then we want to think about the capability and motivation of the person that's meant to carry out the behavior, as well as their context, the opportunity and barriers for them to carry out the behavior. So we adapted that to our study, with the behavior of interest being that owner, manager, initiation of OHS management. From research, we identified 6 factors located in those 3 domains I just described, and we identified 10 measures of those factors. So I'm going to introduce you to the factors and measures, and then we're going to look at their relationship with initiation. Starting with OHS knowledge. We asked, how much do you know about the following topics? We asked about 10 topics, and people could respond with a lot, some, or very little or nothing. We assigned a score to each type of response and then took an average across the 10 items. And then looking across all businesses, we find an average of 2.1 out of 3. In other words, some knowledge. And there was a full range of reports where some businesses reported very little or nothing about all topics, and others reported knowing a lot about all topics. We took a similar approach with the 2 measures in the motivation domain. With OHS self-confidence, we asked about 5 different activities and their confidence in carrying them out. These were activities like training all employees or purchasing equipment to protect workers. Overall, businesses said they were confident. There was variation here too. In terms of OHS outcome expectations, this was concerned with expected positive outcomes as a result of putting good practices in workplace safety and health in place. So we're looking at their perceived likelihood of positive outcomes, and on average, they thought it was likely. So these were things like it was likely an injury would be prevented, or it would benefit the business, or it would benefit them as an individual. So turning to the last domain and the 3 parts of it, starting with the opportunities, we are particularly interested in the opportunities provided by the health and safety system. So we asked about the use of information or services from the Ministry of Labor, HSAs, and WSIB, developing a count from 0 to 3, depending on the number of types of organizations they had used. We asked if they'd ever been visited by an inspector. On the flip side, we asked about barriers and counted the number of reasons for not taking action on OHS. And we provided 7 possible reasons. These were varied, like it's too costly, I didn't have enough time, I didn't know I needed to take action, and I didn't know where to find information, etc. So half of the businesses said they had no barriers, and on average, it was just under 1 per business. We had 4 indicators of the business context, and we'll return to those on this next slide. So this slide simply summarizes the result of 10 separate statistical tests, each of which looked at the relationship between the measure on the left-hand side and initiation. And the statistical significance, you're seeing if there's more asterisks, it's more statistically significant. So let's start at the bottom of the table. And this, to me and others, was a surprising result, that the time that had passed between registering their business and filling out the questionnaire, which actually varied from 60 months to 40 months, had no statistically significant relationship with the outcome. As if, at least in that early period, if you just leave them, it won't make a difference, right, as time passes, whether they initiate management or not. The number of full-time employees did not reach statistical significance, weak relationship, whereas the others did have a statistically significant relationship with the outcome of initiation in the direction that you would expect. So that is, initiation was more likely if the workplace was assessed as having the hazardous exposures of concern, if they were in a goods producing industrial sector rather than service providing, if they had fewer barriers to OHS actions, if they had been visited by an OHS inspector, if they had made greater use of, sorry, this is a ministry inspector, which could be employment standards too. So if they had made greater use of the public OHS information and services, and also if they had a higher score on any of these three measures, on each of these three measures, rather, outcome expectations, self-confidence, and knowledge. Our next step was to put all of these measures into one model as predictors. And so we're examining the relationship of each measure with that outcome of initiation while taking into account the relationships of all the other measures. And the result of that was to identify two measures that from the model had a highly statistically significant relationship with the outcome and also had a meaningful magnitude of effect or strength of association. And let me illustrate that with the knowledge score. So the model told us that an increase of 1 unit in the knowledge score corresponded to a 48% greater prevalence of initiation. And to illustrate, just imagine a group of businesses, all of which had a level of knowledge of some. And if you compared them to a group of businesses that knew very little or nothing, and everything else was the same, you would expect to see the prevalence of initiation being 48% greater in this sum group. And same with if you compare a lot to some knowledge. And looking at OHS self-confidence, we see even greater effects skewed towards the lower part of the scale. And that is, if we were to compare somewhat confident to not at all confident in isolation, we'd expect to find 4 times more prevalence of initiation in the somewhat confident group. And from comparing confident to somewhat confident, 2 times greater prevalence. So let me recap a couple of key points. I've shown evidence of a lack of basic OHS management in some new businesses with employees, even in the presence of hazardous exposures of concern. And I've shown evidence that both OHS knowledge and self-confidence have important associations with the initiation of OHS management. So it begs the question, well, why do some businesses have more OHS knowledge and self-confidence, or business owners, that is? And is there anything public authorities can do to enhance this knowledge and self-confidence? And I'm afraid this one study cannot answer all of those questions, both of those questions. But we can, I can share some more results that give suggestions of where we can look. From research, we know that knowledge and self-confidence can be enhanced through education and training. And from our research, we also have some insight from asking them which information sources were definitely helpful in helping you in taking action in occupational health and safety. And we use different terminology. It was, workplace health and safety or protecting your workers. And you're seeing the percent of businesses that endorsed each of these. So most strongly endorsed, as you see, was previous work experience, which we can imagine enhancing OHS knowledge and confidence. And if you look at the top 6, I've indicated 2 types of clusters, right? There's what I consider a personal cluster, their previous experience, their education and training, friends, family, and personal contacts. So really what they might be bringing to the workplace. On the other hand, there also are these public OHS resources cited as definitely helpful, and I think to me indicates some role of such resources. So let's now look at what we learned about potential interventions. One thing we were interested in exploring and determining the feasibility of was the idea of a free online OHS course. We wondered whether such a course could be incorporated in the process of business registration. So we wanted to know the appetite for it. We asked how much time they would have available over the next month for such a course. And you could see most often they chose one hour. Now, when we extended the timeline to over the next 6 months, you can see the most popular choice was 3 hours. And so, of course, being human, they probably estimated their time availability over the next 6 months. But I think we can take away from this slide a certain openness to a free online OHS course. And yeah, as long as it's not too long, maybe an hour or max 2 hours. Now, this is where the online course sits when we asked about a variety of different possible resources. So 45% thought an online course with OHS basics would be very helpful. And there were 3 suggestions that were even more popular. Contact information for an OHS expert, a website with customizable templates, which I know exists in the Ontario system, and a guide to workers' compensation for their type of business. The third and final aspect that we explored is perhaps my most important slide, and I thank our advisory committee for suggesting this question to us. And that is, what is the best time to learn about OHS resources? And you can see up to 80% said that the best time is at the time of registration or before. And when I line that up with what happens in the province due to historical developments, and this comes from talking to people, looking at documentation, that I think the dominant flow of events is a business registering with Service Ontario. And if they're in the know, they would know that when they hire employees, within 10 days, they should register with WSIB if they are in a sector that has mandatory coverage. And WSIB will let them know which health and safety association is aligned with their sector. And over the past few years, increasingly, health and safety associations have reached out to businesses, new registrants with WSIB, to the extent resources allow. And at that point, then these businesses are introduced to that wealth of OHS resources that the HSAs specialize in. So I lay this out to suggest that I think there's opportunity for delay and even disconnect. For one, not all sectors need to register with WSIB. In our sample, we estimate 80% should have if they truly had hired employees. Yeah, we estimated 80%, and we see 33% had registered from one of our questions to them. So let me add then to that recap we did before 2 bullets. 1, new businesses show a preference for OHS resources at time of business registration. And then a question. Might we increase the opportunity for new businesses to be exposed to OHS resources in a more timely way? And of course, I'm speaking in the Ontario context, but then think of your own jurisdiction. To what extent, and do you know, is there alignment between the point at which businesses are most likely to learn about OHS resources and the point at which they would be most receptive to them? So I'm going to finish with two slides. In terms of the limitations, I want to remind you that we purposely excluded a third of businesses that we figured were from lower harm sectors based on statistics. And we had a low response rate, as is typical for any survey of businesses. This was a cross-sectional survey. So anything that's been implied in terms of causality needs to be investigated further for confirmation with future research. And we may not have measured everything that is important. On the other hand, we used an innovative sampling frame. We addressed a research gap. We had a good number and diversity of businesses. We were guided by a theoretically based conceptual framework. And we think there's the potential for policy relevance. And that takes me to the end of my slides. And now I welcome your questions and comments. And if you don't have a chance to pose them today, this is my email address, and do feel free to reach out without hesitation about anything you might want to follow up on. Thank you.
Thank you very much, Lynda. Very interesting presentation. We don't have a lot of questions at the moment, but I do encourage people to please send in your questions and comments. I will start with one question. Is there research? I know that maybe not in the new businesses, but is there other research that you're aware of through some of your work on training that talks about when is the best time? On the one hand, you have people early on who should be thinking about this, but who may not be fully aware of all the ins and outs of what they may need. But waiting too late is also a problem. Is there research out there that talks about this?
Not that we're aware of, and I think the model that we uh, have in mind and in talking with practitioners is as well, and just thinking about how people acquire knowledge is, I think we really want to think about multiple time points, right? And so we're saying at the time of business registration, that's an early time point. There really seemed to be an appetite there, according to the 80% that preferred knowing at business registration or even before. And of course, there's going to be later time points that are appropriate too. From the interviews, we've learned that as people, especially the entrepreneurial type who are thinking of growing their business, that can also be a trigger for seeking out and wanting to learn more about and getting more sophisticated in OHS. So yeah, I think what was being done with WSIB registrants. That's good. And we're not suggesting that should be replaced. We're suggesting let's add on and have an early time point and not let any businesses fall through the cracks. Sometimes we need reminders, and sometimes we need reinforcement, and just we would hope a base would be established with that basic information, as well as learning, who to reach out to. And then they can build on that base as needed as time goes on.
Okay, thank you. We do have some questions. Were you able to assess how businesses that also fall under the public health regulations, like restaurants and personal care, are provided with or access this kind of information when they're opening? So, are public health units more active in connecting with these businesses, to your knowledge?
Yeah, I think there is a bit of a theme in that in the interviews. And sometimes there can be kind of overlapping requirements that as you're thinking about public safety, there can sometimes be requirements that benefit employees as well. It also tends to kind of foster a mindset of standards, regulations. It's an opportunity to learn about occupational health and safety regulations. But I can't get any more specific than that. But do stay tuned for the interview of the presentation about the interviews in the coming year, because I think they'll have a finer comb appreciation of that.
Okay, and somewhat related to that, to your knowledge, in Ontario, are all employers covered by an HSA? And is there any perhaps plans that you might have on a further study on connecting with the HSAs after registration?
Yeah, certainly we have project advisory. Our project advisory committee has representation from HSAs. There are some conversations that are starting as a result of this research, so there's no definite plans. And as far as kind of the scope of the HSAs, um, there's certainly no sector excluded from HSAs. They don't do a screening and you can't come to us. You can't use our free resources, for example. Um, so, uh, yeah, there's an HSA for everyone.
Okay, thank you. You mentioned there were some, I think, industry differences, goods versus services and things like that.
Hmm.
Someone would like to know whether or not there would be a group of small business owners that you might think should be targeted first or most or differently based on your findings.
Yeah, I think, interesting. Yeah, definitely the goods producing sectors like construction and manufacturing were more likely to have initiated OHS management, but it wasn't a black and white situation. I'd have to, maybe there was a 20% difference, 60% versus 40% initiation if you compared the goods versus services. So there's some correlation, but it's not black and white. That said, as we contemplate integrating this into a registration of businesses, um, I would think the so yeah, so there's a need even in those goods producing sectors. So I in general, I think we want to prioritize where there's more risk. But it seems as though the very basic information should be appropriate for everyone.
Okay. Do you think there's an appetite for mandatory training in OHS for new businesses?
So we actually explored this in the interviews, and we were surprised that there was quite a positive response to this. And we've had conversations with employer associations, just high level conversations about this. And we haven't seen serious pushback. We haven't been getting pushback. We've actually been receiving most often positive comments in the sense that businesses at that time when I think there's been a reluctance to burden new businesses. They have so much to learn, and we did ask about challenges, so we're not naive to them. Um, Financing, financial management, finding the right employees, finding the right location. We had open-ended questions and a big response to those questions about their biggest challenges. So there's been a reluctance, of course, to burden businesses. That said, they're at a stage where they are learning so many things, trying to put things in place. We've heard, yeah, just one more thing, add it to the list. And so I think if it's not particularly burdensome, and in fact, it can help, if we can think about this as support to businesses, they've talked about one-stop shopping. Maybe there's modules for OHS and employment standards and tax and these kind of difficult topics. And some businesses would welcome this. So mandatory, so I think it's always, there's a reluctance to make it mandatory, but maybe there's also this idea, and my colleague Bashak uh, knows this too. She and I, in different projects, have talked to leaders of medium and small size businesses. And there can be a storyline of we didn't know what we didn't know. Uh, so by making it mandatory, slipping it in, you know, we know what you should know. Um,
Right.
we had 30, we asked about, found legal requirements. Only 38% had found their legal requirements.
So this is staying with this kind of mandatory and legislation, and people not knowing necessarily this. We have another question. Someone asking about a study that I think you're aware of, a Boston area study of nail salons, and the dual impact of legislation and OHS resources. The person is wondering whether your study would provide any insight into what type of legislation could be introduced in Ontario or other provinces or Canada that might assist more new small businesses to comply and create a healthy and safe workplace.
Yeah, so not being a policy legal expert, I don't want to go too much out on a limb to be making recommendations, but I can say a bit more about that particular study the person cited, and I think they must have read our environmental scan study or the lay summary of it, in that we had searched the research literature for research about interventions with new businesses. So we found that the one being referred to is the only one we had searched for small businesses. Anyway, so there's only one that actually de facto focused on new businesses, and it wasn't even their intent. Um, but what I thought was quite interesting is this was nail salons. They were concerned about ventilation, and they spent several years making outreach of an educational type, to bring about change in the ventilation in these nail salons. But they didn't really get traction until they created a ventilation standard and made that part of the licensing requirements, that you couldn't open a nail salon without having this required ventilation. So in our review, we actually found there was very little use of kind of this coercive approach, if you will, regulatory approach, a lot of educational approaches. But I wonder if there's more opportunity for just, making it part of a process, not a separate, ball of red tape, but integrated with other processes that are going on. In our case, maybe it's registering the business. In that case, it was getting a license for nail salons.
Okay, thank you. One of the individuals, just a comment, one of the individuals who has joined today notes that they do work for one of the HSAs, currently have worked for another one previously, and is wanting everyone who's listening to know that they do have some great resources and encourage people to explore all of them. They also have consultants that people can get a hold of. It's not the only way to initiate occupational health and safety, but it can be an important one and a beneficial one. So just wanted to acknowledge that comment. And you're nodding, Linda?
Yeah, I just wanted to underline that we did, as part of the environmental scan, carry out interviews and found there was more going on in the field than there was in the research literature.
Okay, thank you. You mentioned an advisory committee. Someone is wondering, with the data that you've collected, will you be talking to WSIB on how some of your data may be impacting small businesses and possible solutions?
Yeah, definitely. We did, and here's the committee. We did share preliminary findings back in the fall, and we will be convening again in June. And I think conversations are starting to happen. Thank you.
Okay. Um, Someone has commented, since HSAs and the Ministry of Labor don't know about new businesses when they register, are there particular organizations or government agents who could be the best ones to instigate the process of OHS initiation in new businesses?
Yeah, so let me see. No, I don't want to flip through this. Let me go back to here. Yeah, so as I said, businesses register with Service Ontario, and yes, as I said, they're in a ministry separate from the Ministry of Labor. Um, However, there has been some pilot work done where the the Ministry of Public and Business Service Delivery and Procurement has shared information with the Ministry of Labor, and they have done some outreach. So this is a simplification. However, that was a pilot program, summer program. It's not established yet. So that suggests one route, I guess, where um, information and different stakeholders could be involved.
Okay, thank you. We have a comment question. Someone notes, I think there is a requirement for Ontario businesses with more than 5 employees to have a health and safety representative. Did that come up?
We did ask about that, but you'll recognize with our tiny businesses, it didn't apply to most. I don't think it's on this slide, no. Um, yeah, so I guess we have such small numbers, and I'm sorry, I will go back and look at the compliance with that particular requirement. Sorry
Does
about
that,
that.
maybe just to follow up then, that sounds like then a different type of initiation. I mean, and so smaller versus very small, micro versus sort of
Mhm.
slightly larger. Are there thoughts about then initiation and training dependent upon some of the numbers of employees or?
Yeah, I mean, yes. And in a way, so right, with five, need to have a worker rep. But if you haven't had prior training, maybe you don't even know that you should have a rep by the time you get to size five. Um, so yeah, I do think it's appropriate for training for businesses of different sizes. And maybe suggests we've overlooked the smallest size.
Right. Um,
We have training in mandatory training for workers and supervisors. We don't have one for owners.
right. Okay. Um, Someone is asking for a little bit more information about the types of businesses that you had in your study, and specifically, do you have a sense of how many respondents were becoming new owners as a perhaps franchise owner versus a brand new unique company?
Yeah, the majority were unique companies. We did ask about whether they had registered previously in another province. Most were new to Ontario, And that's what we tended to find in our interviews as well.
Okay. If you were responsible for designing some new training over and above perhaps what you know is available for HSAs, and you were to focus on new businesses, um, is there anything that you would want to tackle, something new that you would want to, or is there more something you would want to have included in your research to really help you do that?
Hmm. Um, the HSAs have developed introductory and WSIB too, I think, um, have developed introductory materials for small businesses. And I think a lot of those materials would be appropriate. And um, and as far as adding anything is maybe, the awareness of the health and safety system as a whole. And so I think it's not so much, I think it's maybe tweaking existing materials, training products, as opposed to reinventing the wheel.
Mhm. Are you aware of other jurisdictions, other provinces? Are there differences in materials and learnings that might be available? Are there differences in requirements for new businesses as far as you know? I know you said that there's a lot of lessons we can learn from your study in other provinces. What do you know about what might else be available?
Yeah, we weren't successful in finding an appropriate contact in all provinces. That said, I have done a scan of all provinces as a working in collaboration with a student from TMU. Um, and so it wasn't it wasn't popping out of the pages for one thing, the web pages. And in our interviews, so we didn't interview every single province from the ones that we did have a representative of. It's again not well established. I'm not hearing of well established programs that Ontario can then, look at and adopt.
Okay. Someone has commented you had a slide about where people got their information
Mhm.
in terms of, and it included things like family and friends and government sources, their own formal education. And
Oh,
government
wow.
sources didn't seem to be as prominent as some other ways people say they're getting their information. Um, I guess a couple of things. Why do you think that is? And are there ways that we could perhaps make government, I don't know, the person is saying be seen as more credible. Is that the issue that they aren't credible, or is it just that this is not the first thought where people go?
Yeah. So maybe if we introduce them at the point of business registration, we would see greater prevalence here. And I think it just reflects what we know from the small business research and just the informal approach that people can take to managing their business. So therefore, they're very much drawing from their personal experience and education and contacts. And
Okay.
so I think there's the
Yeah.
potential for enhancing the use of the publicly available resources. Um, People can sometimes develop blind spots, I guess. They're limited by their personal experience, which they may or may not have been in a, very pro-safety organization.
So do you have concerns about people relying on others like family or friends as a fairly important source of information?
Yeah, um, I mean, they could have an OHS professional in their family, I guess. So that could be fruitful, but I think sometimes they're the resource because that's who they're most in contact with or most comfortable with. So it varies, I think.
Okay. We have, just to let you know, there's a lot of comments about the HSAs, what they have available, making better use of them, trainings that people are putting in the question and answer box. And I want to thank you all for doing that. I guess at the end of the day, um, do you th so you had you I guess in some ways it was a bit surprising that people didn't say barriers were as important to initiation as they could. Knowledge was certainly something that came up, and again, a lot of people are putting down various sources of information that could improve knowledge. Want to just ask you, I guess, in the time we have remaining, maybe just the one more question about self-confidence. That came up. And do you think that providing people with just information is enough to also improve their self-confidence? Since both of those things were important and they are not entirely the same. Can you just talk a little bit about self-confidence?
Yeah, so great question. I think self-confidence a lot will develop in having practiced or moving towards practice. And so I would have more confidence. Good question. I would have more confidence in OHS self-confidence being developed through training as opposed to simply information.
Okay. Um, do we have a lot of research out there on training to build self-efficacy, or is it training to kind of problem solve in these areas?
You know, there's not a lot in the OHS field, but I think we could look to other fields to have a fine-grained appreciation of that, of what would be necessary.
Okay. Well, thank you, Lynda. Very interesting research, and looking forward to also some of the interview data that will be coming, I think, this fall. We'll be seeing a presentation on that. And want to thank all of you who attended today and for all your questions and your comments. Again, we will be making the slides available, so you will have access to the presentation. And I hope you will join us in May, on May 26th, when we will have our next speaker series presentation. Dr. Peter Smith will be giving that presentation, and it is on preventing and managing work-related psychological injuries in Canada and Australia. So thank you. Have a wonderful day, everybody.